Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the worst is far from over. The government says it's bracing for another COVID-19 surge mid-2021. What are the preparations in place to prevent overwhelming the healthcare system again? Also, a group of healthcare workers denying claims made by Health Secretary Francisco Duque that they're tested for COVID-19 every 2 weeks. Health spokesperson Maria Rosario Vergeire joins us live. And later, the government summons Chinese ambassador to the Philippines, Wang Jilian, as hundreds of Chinese vessels remain at the disputed Julian Felipe Reef. President of the Philippine Association for Chinese Studies, Romel Banlawi, is also with us in the program. National Task Force on COVID-19 Chief Implementer Carlito Galvez warns of a possible COVID-19 surge in June or July of this year. Galvez issues this warning even as the government continues to deal with high numbers of COVID-19 cases and deaths. Meantime, the group Filipino Nurses United disputes claims by Health Secretary Francisco Duque that health workers are being tested for COVID-19 every 2 weeks. They add health workers still work longer hours and even lack protective gear. Let's go straight to the source of the story. We have Health spokesperson and Undersecretary Maria Rosario Vergeire. Yusek Vergeire, always good to have you on the show. Welcome to the source.
Good morning po, ma'am. Good morning to all of you.
So let's start with the numbers. Yesterday, we recorded over 8,000 new infections. I just want to make it clear, Undersecretary, that is this an artificial decline? Because in the past, I know you said that I think it's during Tuesdays and Wednesdays that medyo bumababa po yung mga COVID infections natin.
Yes, ma'am. So yesterday's numbers at around 8,000 plus was an artificial decrease because during the weekends, our laboratories, some of them, are non-operational. So last Sunday, we had 36 laboratories which were non-operational. So yesterday's numbers was a little bit low. So this is just artificial. It is not a true reflection of it is not true that the cases are declining.
So let's not be complacent because, we haven't seen this number, 8,000, in a while. At an average, we're looking at about 10,000 daily cases. But when do you think, Undersecretary, will we start seeing a decline in the numbers?
Yes, ma'am. So if we try to analyze it the way that the incubation period of this virus is, we have 14 days for its incubation. So we started off with our ECQ about 2 weeks or less than 2 weeks ago. So we will start to see the effects of this ECQ about 10 to 14 days from now.
So nasa ano na po tayo 2.5 weeks. 2 weeks of ECQ and half a week of MECQ. So are you looking at possibly next week we'll see a decline in the numbers?
That is our hope, ma'am, that the numbers will start to decline by next week because of all of these measures that we are now implementing.
Must we prepare, though, for a possible surge in June or July? Because Secretary Galvez was saying this is a likelihood.
Well, we have to qualify the statement of Secretary Galvez. He was just trying to say that there might be this possibility of another surge in these coming months if we are not going to continuously comply with the protocols and if we are not going to be able to contain the spread of this virus. So having said that, we need to prepare that there would be another surge maybe in a couple of months, maybe towards the end of the year. We don't know because nothing is certain right now. What we really need to do is to ramp up our efforts so that these surges will not happen again.
Okay, but what could, so you're saying don't think June or July. It can happen, a surge can happen anytime if we don't have the proper measures, protocols in place. So it can happen in June, it can even happen in August or even the end of the year.
That's right, ma'am. So it was just saying that we always need to be ready.
Okay, pero Yusek, what could, for the health department, what are the red flags that you would consider, ito, papunta na tayo sa isang surge muli?
Well, unang-una po, we will be seeing the increase in the number of cases. That's one. The second would be our healthcare utilization. When we see our hospitals being challenged again with the number of patients going in, that would be another indication. What would be most critical in this kind of increase in the number of cases would be for us to maintain our healthcare system. And that would be that our hospitals can still accommodate as much patients that will be needing these beds in the hospitals. Also, we will also make sure that there should be this healthcare human resources and the quarantine facilities that we have.
Yeah, but it seems what happens, Yusek, I'm not sure if you will agree with me, is that when we saw decline at 1,000 infections every day, tapos yung reproduction rate natin or R naught was less than 1, you know, let's set aside yung tao kasi naging complacent din yung ibang tao. Of course, the economy open, there is mobility, but the quarantine facilities, yun po yung mga kailangan i-maintain. Siguro until when ho, Yusek? Because parang nakakalimutan ho sila or at some point, these quarantine facilities are being converted into something else because there seems to be no need for it at a certain point.
Yes, ma'am. Actually, during the time that we had the increase in the number of cases, we had these mega facilities here in Metro Manila and in nearby regions. But as the cases declined, the maintenance and the resources needed for us to maintain these big facilities kasi is really a challenge for government. So we decided to close down some of this, but we have still maintained about 11 of this. So it was not totally removed. We still were ready. We had quarantine facilities, but because of the resources required, we had to a little bit lower down the number of these mega facilities. But as soon as the cases were rising already, slowly we started opening up these big facilities again.
So numbers, no, there's a bit of good news if we look into the R naught or the reproduction rate because at a peak, umabot na po tayo ng 2 or 2.1 if I'm not mistaken. And then now I believe we're at 1.1. What that really means for the benefit of our viewers is sa bawat isang taong positive, may isang taong nai-infect. Hindi ko katulad dati, sa bawat isang tao, tama ho ba, dalawa yung nai-infect? Yeah.
Yes, ma'am. Actually, the transmission rate or the R naught, the Department of Health and the government doesn't really rely on this solely because it is really affected by a lot of factors. So it is affected by, first would be the number of cases. What we report is that is what we use for us to estimate this R naught a transmission rate. The second would be that the other factors inherent or existing already in our country affects this also. Like we have the variants, we have the mobility of people, we have the delays in the reporting of cases, delays in the detection of cases, and delays in self-declaration of individuals with symptoms. All of this will affect this transmission rate. That is why we only use this as one of our parameters. We use the other parameters as well so that it can be more holistic and comprehensive.
Well, really important, the 3 pillars, of course, testing, tracing, and treating. At testing, I want to go back to possibly the past week, Undersecretary. And I think it was last Saturday that we had about 40,000 tests. Parang in what I've seen in the past, that seems to be the highest number. Health experts, again, keep saying we need to test about 90,000 individuals and we're not even reaching half of that. What is the problem, Undersecretary? Bakit po hindi natin naaabot? Yung ang average is definitely far from what is being recommended na 90,000 tests.
Well, actually, ma'am, no. So first, our highest to date, no, as of April 8, we had 63,000 tests done. The weakness in our testing capacity would be the distribution of our laboratories because our laboratories, not here in Metro Manila because we have a lot of laboratories here. But in the other areas of the country, there would be one or two laboratories only in one region. Although all regions now have their own laboratories, but we still lack some laboratories in other areas. So right now, what we did, because there is this increase in the number of cases, the rapid antigen test will be used so that we can be able to appropriately manage and do our detection through testing. So rapid antigen test will be deployed in the different communities of Metro Manila so that it will be part of the strategy, and there would be faster testing, and we can easily isolate these individuals who will test positive with the antigen test.
With this antigen test, I remember speaking to Secretary Vince Dizon. We talked about this 2 weeks ago. Just for the record, has this been used? Government was saying this would be used in barangays. Parang ang tinatawag din po, targeted testing in barangays. Naumpisahan na ho ba ito?
It was already distributed over the weekend across the different local governments and different hospitals in Metro Manila. So we expect that it has been used already because they are already going house to house, so that the testing and the results will be faster, so that we can easily isolate.
But you're not sure if it's already being used?
Yes, because the distribution has been done over the weekend. I think that was last Sunday and then Monday. So we can see maybe towards the end of the week that this antigen test will be used already.
And you already said, no, Yusek, that the antigen test will form part of the daily bulletin of the DOH. Isasama na po siya doon sa daily infections that you publish every day.
Yes, ma'am. We will be including this as part of our official numbers, but based on the definition and the criteria. So only those which will fit the criteria or definition that we have indicated in the protocol, those are the ones that will be included in our tally.
I see. So because I look into that also every day, Yusek, magkakaroon ho ba ng different categories si new infections na PCR and antigen? Ganun ho ba yan? Or i-combine lang po talaga?
We will have a total case report, but we will also have that kind of disaggregation where we will show how much were tested positive with RT-PCR and how much tested with our rapid antigen, so that people will understand how much the rapid antigen has contributed to our total cases.
And then those who will be positive for the antigen, do they have to go through a confirmatory PCR?
No, according to our protocols and according to guidelines of WHO, as long as you use the rapid antigen in areas where there is high prevalence, like right now here in the National Capital Region, we have this widespread community transmission, the results of the rapid antigen test would be considered positive already and confirmed. No need for repeat RT-PCR.
So it's almost as if pag nag-positive ka ng antigen, you are considered positive for RT-PCR, which is, as we all know, the gold standard in testing. Under Secretary Vergeire, we need to also talk about hospital utilization, because it was also Secretary Galvez who looked into the active cases and how much bed we need, or how many beds we need here in the country. We will be taking a very short break. The Source will be right back. Welcome back to The Source. I'm Pinky Webb. Our guest today, Health Spokesperson under Secretary Maria Rosario Vergeire. Hospital utilization. So according to Secretary Galvez, if we look at the active cases, he put it at about, we'll be needing 2,000 beds for the critical patients. That would be a combination of the severe and critical. And right now, he says we have about 1,300 and we need 600 more beds. Again, this is just for the critical and severe patients. Do we have these 600 beds now, Undersecretary?
Oh, well, that was part of the plan, that we will be able to expand the capacity of our ICUs. He's talking about the ICU beds when he talks about the additional 600 beds. And we have already expanded over the weekend about 164 extra beds for ICU across the different hospitals, both public and private, for the ICU beds. So this
I see.
600 is our target, and we are still negotiating with hospitals so that we can expand further.
But malayo pa ho yun, Yusek. Kung 164 across the hospitals, ibig sabihin, kinausap niyo na po yung mga hospitals, dagdagan niyo na yung inyong mga kama for ICU. So you have a balance of about 450 more or less, or 440 ICU beds that we need.
Yes, ma'am, but this is not the only strategy that we are employing right now. We are trying to do the step-down care program where we are trying to decongest our hospitals. So
Right.
when you do that, about 41% right now admitted in our hospitals are mild and asymptomatic. And we have also expanded our isolation facility so that we can be able to transfer the patients, no, if they are for discharge already or are have resolved symptoms already, so that we can transfer. So once we are able to decongest our hospitals, then the hospitals can already have this capacity to expand more, especially for ICU beds.
I do understand that completely, because Undersecretary Vega did say that dapat ilipat na yung mga mild and asymptomatic. But there are problems and concerns with that. Number one, families might not want to move their loved ones to an isolation facility or a level 1, level 2 hospital. I guess the question really is, Undersecretary, because ICU beds are needed right now. What can we expect in the next couple of days para po madagdagan yung ICU beds?
Well, aside from expanding the ICU beds in the different hospitals, we also are able to expand already by having this modular ICUs or this extension ICUs in other areas. Like we have the QI, Quezon Institute Extension of JR or Jose Reyes Hospital, where we have started opening up already and accepting patients who are moderate to severe. We also are opening the National Center for Mental Health with a capacity of almost 1,000 beds for mild to moderate cases. So by doing this, we are hoping that we can decongest further the hospitals and we can be able to expand more inside the hospital for these ICU needs of our citizens.
And I want to go back to testing, because Secretary Duque said that healthcare workers are actually being tested every 2 weeks. This was his report to President Rodrigo Duterte the other night, to which some sectors are saying, and even in social media, the Filipino Nurses United and some netizens are saying this is not true. In fact, I remember a netizen saying this is a blatant lie. What really is the protocol for healthcare workers, Undersecretary? Are they really being tested every 2 weeks?
Yes, ma'am. Actually, we have this department memorandum wherein it states that all hospitals should have their healthcare workers tested, especially those catering to COVID-19 patients, every 2 weeks based on the resources of the hospitals. So if the resources of the hospitals would not suffice, at the very least, they should be testing their employees regularly. If it's once a month, if it's once every 2 months, at least the workers will be tested and they can be assured that they do not have the infection.
But it doesn't seem like this is happening, Undersecretary, because indeed it is a memorandum, kumbaga utos ng gobyerno sa mga ospital. I-test niyo yung mga healthcare workers every 2 weeks, but it's dependent on the, financial capability of the hospital, their resources. What is your reaction to the fact that they are saying this is not happening? What can be done?
Well, we are going to check on this and we will try to assist the hospital so that we may be able to give that protection to our healthcare workers. But as I've said, it depends on the resources of the hospital. Some hospitals right now, they are having this number of individuals who they are testing because of this increase in the number of cases. Maybe that's why they are not able to comply with this department memorandum. But surely, we will check on this so that we can be able to make them comply, at the very least, irregular testing for their healthcare workers.
Because that is really very important. Undersecretary Maria Rosario Vergeire, ma'am, maraming salamat po sa inyong oras. And coming up, the government summons the Chinese ambassador to the Philippines as hundreds of Chinese vessels remain in the West Philippine Sea. After the break, we speak to security analyst Romel Banlawi. You're watching The Source on CNN Philippines.